Hello, everyone. My name is Chanel Bell. Today, I'll be presenting a biopsychosocial review of obesity. Obesity is a complex health condition. It is greatly influenced by three factors: biological, psychological, and social factors. Many factors that we just may be unaware of. This presentation will explore obesity from a health psychologist perspective. Here, I'll emphasize how the mind and the body interacts in the development and the management of obesity. So learning objectives of this presentation will be for one to define obesity, understand the body mass index tool and its limitations, explore the biological, psychological, and environmental contributors, and examine the health conditions associated with obesity. We'll also address the psychological impacts, such as the weight stigma, and discuss evidence based interventions and prevention strategies to reduce obesity. These numbers shown highlight obesity as a global epidemic requiring a biopsychosocial approach. Globally, more than 2 billion individuals are overweight or obese, including at least 37 million children under the age of 5. In the United States, obesity rates have continued to climb across all age groups, representing one of the most significant public health challenges of the 21st century. These figures emphasize the need for comprehensive, multidisciplinary strategies to address obesity at both individual and community levels. Obesity is characterized by excessive fat accumulation that impairs health. According to Stanton and Taylor, it occurs when caloric intake consistently exceeds energy expenditure. For adult women, a healthy body fat range is approximately 20 to 27%, while for men, it is 15 to 22%. These values vary based on genetics, age, and lifestyle factors. Obesity rates often differ between men and women. Studies show that women are at higher risk of becoming obese than men. Estrogen levels, where men don't have estrogen, influences fat distribution in one's metabolism. Women are more prone to emotional eating, especially when they undergo their menstruational cycle. Things such as this are all factors to consider when looking at the gender disparities in obesity. Classifying a person as being obese, it is important to know that physicians use something called body mass index. This is a tool that serves as a calculator that allows one to input their weight and their height to come up with a percentage of body fat that they store in the body. That percentage is then classified into one of three classes. You have class one, class two, and class three. Each class falls under obesity, but the severity differs per class. Chart we're looking at is known as a body mass index chart. There are several variations to what this BMI chart may look like. However, if you note, you will see that the height in meters as well as the weight in kilograms are charted, and you are able to see where you fall based off of this scale as far as your range in your weight, whether you're considered obese, normal, or underweight. It's important to note that obesity, being obese, it comes with severe consequences. There is an array of health issues that can arise from being obese. You can develop 13 different types of cancers just from being obese. You can become disabled from being obese. You can lose your ability to walk, do certain movements, to breathe. Your heart can stop blood flow, all because of the excess amount of fat you allow to be stored on your body. Science allows us to see that there's always a cause behind why things happen. The etiology itself behind obesity can rely on these three factors. It can be biological, something that may have been unpreventable that happened in the womb with the childbearing process. It can be psychological factors such as stress, trauma, anxiety, how one copes with the problems that may arise in life. It can also be environmental, maybe those that we surround ourselves with, such as our friends, our parents, what we see happening around us. There can be so many factors as to what causes one to become obese. And it's important that we understand all these three factors before just assuming that a person is obese by their own choice or given their free will. One of the three biopsychosocial factors in terms of obesity is the biological factor. Simply, it could be one's genetics. Many different things inside our bodies work together to affect our weight. It's not just about simply how much we eat or we exercise. Our genetics are instructions that we inherit from our parents. This greatly can influence how our body stores fat, how hungry we feel, how easily we gain or we even lose weight. Next are hormones. They play a big role. For example, leptin is a hormone that helps us know when we've had enough to eat. It tells the brain that we're full. On the other hand, ghrelin is known as the hunger hormone because it tells the brain when we're hungry. Let's just say if these hormones are out of balance, it can be harder for someone to control their appetite. Another important factor is to consider is one's metabolism, which is how our body uses energy from food. Some people naturally burn energy faster than others, which can make it easier or harder to maintain a healthy weight. Inside our stomach and intestines, we also have trillions of tiny living organisms. They're called microbiome. These bacteria helps us digest food and can even send signals to our brain about hunger and fullness. The kinds of bacteria we have can affect our weight and overall health. So, certain things to consider is definitely the biological factor. A person may not choose to be obese, however, their genetics or their lack of having a fast metabolism or even certain hormones that may not be functioning correct in their body can affect their weight gain or their weight loss. And these are very important biological factors to remember. Now let's talk about the psychological side of obesity. Our minds and emotions play a big role in how we eat and how our bodies respond. Sometimes people eat not because they're physically hungry, but because they're feeling sad, stressed, or overwhelmed. This is called emotional eating. Food can become a way to cope with tough feelings, almost like a comfort or even a distraction. People who struggle with a low self esteem may also have a harder time making healthier choices. When someone feels sad about themselves, it can affect how they take care of their body. Low impulse control can also play a role. This means having difficulty stopping ourselves from doing something we just know isn't good for us, such as overeating junk food, grabbing a bag of chips just because you feel sad, or going to get candy just because you want to indulge in chocolate. Case studies have shown that the brain's reward system can react to food in a way that's similar to an addiction, whether it be smoking, a drug addiction, can be the same for just wanting to overeat. Another important factor is learned behavior. If someone grew up in a home where unhealthy eating was common, like using food as a reward or always finishing everything on the plate, they may carry those habits into adulthood. For instance, a child is told, make sure you finish your food, make sure you eat up. And let's just consider that translating to adulthood when we go out and we get massive plates of food, and it's like our brain is telling us we must finish the food, but your body may ultimately be saying, I am full. Yet you still finish that plate because you were taught and embedded as a child that you must finish all food that you were given. Mental health. This also matters. People with depression and anxiety may find it harder to stay active or eat balanced meals, which can increase the risk of weight gain. Lastly, there's weight stigma, which is when people are judged or treated unfairly because of their size. This can make people feel ashamed, which often leads to more emotional eating and less motivation to seek help, just because they may feel judged. So, in considering all of this, psychological factors like emotions, stress, and mental health challenges are just as important as biology when we think about obesity. They all, in a way, connect. And understanding this can help us support people in more compassionate and effective ways versus assuming that person is not trying to better themselves. Obesity is often driven by a lot of those psychological factors just discussed. People often use food to cope with stress or even their emotions, creating a cycle that's hard to break. The psychological effects contribute to weight gain and are also worsened by it. Real change starts by addressing the emotional roots and not just focusing on the diet in itself. When it comes to obesity, it's not just about personal choices. It's also about the environment people live in. Many neighborhoods lack access to safe spaces for exercise or affordable healthy food. This makes it hard to maintain a healthy lifestyle. Fast food is often cheaper, more available than fresh produce, especially in low income areas. Social and cultural norms can also greatly influence eating habits, and constant exposure to junk food advertising, especially for children. This shapes unhealthy behaviors early on. Economic pressures like time, money make quick, unhealthy meals the easiest option for many. From a health psychologist's perspective, real change requires addressing the environmental barriers, not just focusing on the individual's willpower. You can treat obesity, you can reduce your chances of becoming obese. There are several outlets and sources that you can use to manage this serious chronic disease. There's awareness spread throughout your local schools, your private schools. It's broadcasted on television. It's all about using and wanting to find out more, educating yourself on how you can really prevent yourself from falling victim to obesity. The government recently created initiatives that limit individuals who receive government funding to go out and buy junk food with their food stamps. Simply, it's their way of saying, let's help reduce the spread of obesity. It is possible. It does start with you, and you must go out and seek the help, seek the education, become knowledgeable, because reducing and eliminating the spread of obesity is possible. We've addressed the three biosocial factors around obesity. Let's talk about changing our social influences. Social influences, the people around us, can influence our health. And how can we make that influence a positive one? It's important to follow these things. Create positive support system. Studies show that our social ties, like our friends, our family, even our coworkers, can actually affect our body's weight over time. If the people around us have healthy habits, we're more likely to follow them. But the opposite is also the same. That is why it's helpful to change your environment, especially your social environment.
if you want to change your behavior. This means surrounding yourself with people who support your goals and encourage your healthy choices. Social support can be a powerful tool when trying to lose weight or even build healthier habits. Support can come from many places. Social media, for instance, one may start uploading their daily blogs or journals just to show and be encouraged and motivated on their weight loss journey. Following positive and healthy focused accounts can also help keep you motivated. Family and friends, having loved ones who cheer you on may even join you on the goal can make a big difference. Therapists, counselors, they can help you work through your emotional and mental challenges that might be getting in the way. Changing your social influences doesn't mean cutting people out of your life. It just means being mindful of who and what is helping you grow and who might be holding you back. For instance, think of someone who is a drug addict. If they're no longer or they're trying to break away from those bad habits, they don't want to surround themselves with just drug addicts because it's likely that they will fall back into the cycle. Same for obesity. If your circle is someone that is constantly eating sugary foods around you, wanting to go out and dine, wanting to put all this energy in food, it might be wise for you to change who you're hanging out with so that you can have a positive support system around you.
Does obesity have a cure? Simple answer is yes. The cure is you. You can treat obesity. You can change your life. You must implement healthier lifestyle changes. Don't go out and just get surgery and do the same thing. It starts in the mind. You must be motivated and set yourself up for these healthier lifestyle changes and not fall victim to your past. It is always possible to create a better lifestyle for yourself. It starts now. It's better to start early on, but you must remember that it is possible to treat this disease. The away from this is to know that it is possible to keep the weight off. Yes, you need willpower. Yes, you may need to change your social influences. All of these things matter when starting a new journey and wanting to progress forward. But it not only is your willpower, it is your environment, those social factors that we do put around us, what you tell yourself. It is so important to monitor your progress just so that you can use that same progress to motivate yourself on this journey, setting realistic goals that you can actually achieve. These are all things that are vital when trying to reduce and eliminate the spread of obesity. Become aware, knowledgeable, and motivate yourself that this is something you can set out and achieve. These are some healthy habits to consider implementing in your life to reduce or even lower the risk of becoming obese.
In summary, obesity is a serious but preventable condition. We know that it's now defined as having a BMI of 30% or higher. Its causes are complex and can range from biological, psychological, and even environmental factors. Despite these challenges, it is possible to prevent obesity. It starts with personal willpower and committing to a healthier lifestyle. This can include dieting, exercise, and taking care of your mental health. If these lifestyle changes aren't made, the risk of obesity just continues to grow. Therefore, it's important to remember that obesity can affect anyone, but by staying aware and proactive, we can all take steps to lower that risk.